So, hello everyone. Welcome to Great Online Training. Myself, Nikita. I am a CPC certified medical coding trainer in Great Online Training. This is day 5. Today we're going to discuss about business of medicine. What do you think? What will we going to discuss in this session? What do you think? What is meaning of business of medicine? Anyone? All right. Business of medicine is nothing but you can say it is the administrative side of medicine or healthcare industry. Okay. Here we're going to discuss about future scope or career opportunities in medical coding. If you see medical coding as your professional career, then what are different possibilities? Okay. Then we'll see different kinds of payers, different kinds of providers, okay, and other rules and regulation regarding coding, okay. Different kinds of insurance provider that we're going to discuss in this session, okay. So we'll see what are the different topics we'll go into covered in this class. Today we'll see coding as a profession, then we'll see hierarchy of providers, then the different types of payers, then we'll understand RBRBS, then medical necessity, then the advanced beneficiary notice, it is also known as ABN, then the need for privacy and security, then we'll see covered entities of HIPAA. Remember, I told you about HIPAA regulation that we'll going to discuss in today's session. Then HITECH and its impact on HIPAA. Then we'll see fraud and abuse and their examples. And lastly, we'll see some acronyms. Okay. So first, coding as a profession. As of now, I hope you will get better understanding of what is medical coding and what are the different career opportunities in medical coding. So can you please, can someone tell me what is medical coding? Anyone? Anything you learn from previous sessions? What is medical coding? Okay, fine. I'll explain you again. Medical coding is a process of taking patients' health information, which can be any diagnosis, symptom, illness, anything, or abnormal finding from patient's report, or any medical procedure, whether it can be diagnostic or surgical procedure, any procedure details patient undergone, or any medical necessity, medical equipment, or any other medical services the patient took that we have to took from physician, or we can say we have to extract that information from patient's healthcare report, and then we have to as a medical coder we have to convert that information into medical codes which are accepted worldwide, okay, and which are numeric or alphanumeric codes, okay. So this process of conversion of medical or healthcare information into medical codes is called medical coding, right? Medical coding is technical and rapidly changing field that offers practitioners a variety of career opportunities, like we discussed in previous sessions also, right? If you choose US healthcare is your profession, or if you have decided to work in US healthcare field, then you have many options, right? You can work as a medical coder, you can work as a medical biller, you can work as a medical transcriptor, or AR caller, denial coder, or any compliance manager, or different position. There are many positions available in this field, but if you choose medical coding, particularly medical coding as your profession, then also you have variety of career opportunities. For instance, skilled medical coders may become consultant, remote medical coder, or medical coding trainer, or you can say medical coding educator, or medical coding auditors, right? Also, you can become a TL and manager, as you gain more and more experience. Right? Coding as a profession has evolved over the past several decades and will continue to do so as the business of medicine embraces new technologies, new course sets, and payment methodologies. Okay, and I think medical coding is very good opportunity for those who are just completing or about to complete their graduation, because this is the only one field where you can directly start your job as soon as you completed your graduation, right? So this is the main or advantage of this profession. Okay, and soon after your completion of your graduation, you get chance to work with doctors. You get chance to work for doctors, and those doctors who's working in US. So I think this is very good opportunity, right? Now we'll see coding as a profession. Okay, each time an individual receives healthcare service, a record is maintained of resulting observations, medical or surgical interventions, diagnostic tests and studies, and treatment outcomes. Okay, coding is a process of translating this written or medical record into series of numeric and alphanumeric codes. Right? There are separate code sets to describe diagnosis, medical and surgical services or procedures and supplies. We discussed this in previous sessions also in first step in medical coding, right? What are those? For inpatient coding, which focuses on physician services and care provided while patient is being admitted in the hospital. Inpatient coders will focus on learning ICD-10 PCS and ICD-10 CM codes. ICD-10 PCS codes are used for inpatient procedure coding, while ICD-10 CM codes are used for diagnostic coding. Where ICD-10 codes are common for whether it is inpatient or outpatient, any patient. Okay, ICD-10 codes are common for all types of patients because these are disease, okay, disease symptoms, illness, abnormal finding. Okay, just difference is ICD-10 PCS code are used for procedure coding on inpatient. Okay, so if you want to become a inpatient medical coder, you have to take took training for IPDRG. Okay, where you get trained with ICD-10 PCS and ICD-10 CM course. Okay. Otherwise, if you take only medical coding training, you will get trained on ICD-10 CM, which are used for diagnostic coding, then CPT code and HCPCS code. Okay. So again, inpatient coders also will assign medical severity diagnosis related groups, MSDRGs, also known as MSDRGs. So again, if you want to choose IPDRG as your coding specialty and you are going for IPDRG training, then there you will get trained with MSDRG, ICD-10 PCS and ICD-10 CM course. Okay. Then outpatient coding focuses on outpatient coding focuses on physician professional services and outpatient facility coding. Okay. Outpatient coders will focus on learning CPT, HCPCS level 2 and ICD-10 ICD-10 CM course. Okay. Generally, in medical coding training, you will get trained on CPT, HCPCS level 2 course and ICD-10 CM course. Okay. CPT codes are also known as, can anyone tell me? CPT codes are also known as, try to give answer. It's okay if you are wrong. Just give me answer. Anyone?
And proceed the terminology and the definition.
No. I'm asking HCPCS are level 2 course. CPT codes are also known as, these are level 1 codes. Okay. HCPCS are level 2 codes, whether CPT codes are level 1 codes. So they are also known as level 1 code. Okay, fine. Then regardless of the setting, means any specialty you choose, code updates and insurance payment policies may change as often as quarterly. Okay, that's the reason coders require continual education to stay abreast of these changes. Okay, so you have to be continue learning. Your learning process should be continuous to get updated in this field, because ICD 10 codes are get updated every year in October, whereas CPT, HPCS codes are updated quarterly. Okay, now we'll see the hierarchy of providers. Now you tell me, who is provider? Earlier we discussed about RCM cycle, revenue cycle management, right? That time I told you we discuss about provider, patient and payer. So who is the provider?
To prepare a standardized bill for services given to a patient.
Correct. So a provider is any doctor, whether a physician or non-physician, anyone, whether it is MD or DO, anyone can be a provider who is certified to give medical care to the patient, right? Whether it can be MD, DO or radiologist, anesthesiologist, pathologist, anyone can be a provider. Or again, mid-level providers are also there, which include practitioners or nurses, right? So we'll see hierarchy of providers. A variety of medical providers, provider staff, physician offices and hospitals, including physicians and non-physician providers. Non-physician providers also known as NPPS. Okay, NPPs, not NPPS, in non-physician providers, such as physician assistant and nurse practitioners. NPPs are often reimbursed at a lower rate than physicians and require physicians' oversight. Different providers have different levels of education, and each state has scope of practice guidelines for various provider levels. If provider is physician, if he is MD, medical doctor, or if he is DO, then they complete their study like 4 years college, then 4 years of medical school, then 3 to 5 years of residency. Residency means training in specialty of practice. Okay. Then if they have mid-level of providers, they include physician assistant, PA, also known as PA, then nurse practitioner, also known as NP. And both PA and NP, both called as physician extenders. Okay, these are licensed to practice medicine with physician supervision. Okay, and provider, obviously, provider is highly skilled, highly educated. I'm sorry, the physician, which is MD or DO, is highly qualified and they have higher skill sets. That's why they reimbursed at higher rate than the NPPs or physician extenders. Okay, because of their education. So this is the hierarchy of providers. Now we'll see the different types of payers. Payer means who is payer?
The amount to be paid to the provider.
Sorry, come again.
To determine the amount to be paid to the provider.
No. Payer is the one who is going to pay to the doctor, right? This is not related to amount. I'm asking you who is payer, okay? It can be patient itself or insurance provider, okay, who will going to pay to the doctor. Although some patients will pay in full for their own medical expenses, most patients will have some type of insurance coverage. What happened in India, we have, few of us have insurance, right? we have covered under insurance. But to avail those insurance benefits, we need to get admitted into the hospital, right? For at least 24 hours. Then only we are eligible to get those insurance benefits, right? But in US, what happened? Their cost of living, their cost of service, their cost of procedures, their quality of procedure is way too high than India. That's the reason why they have buy insurance, or they pay some amount as a premium to the insurance company, right? And most of the people in US will covered under some form of insurance, either private insurance or government insurance. Okay, and that's the reason why there in US, even though that is small outpatient visit, that is also covered under those insurance. Okay, which is not happening in India. In India, we are our small outpatient visit is not covered under insurance, right? Only if we get admitted into the hospital for at least 24 hours, we'll get insurance benefit. But in US, even though you go for normal fever or cough and cold, then also insurance company will going to pay on the behalf of you. Okay, so there are two primary types of insurance or insurers: commercial and government. First, we'll see commercial insurers. These are private payers that may offer both group and individual plans. The contracts they provide vary, but may include hospitalization, basic, and major medical coverage. For example, Blue Cross Blue Shield organizations are private payers who usually operate in the state in which they are based. Okay, Blue Cross Blue Shield is most of the private insurance. Okay, now we'll see government insurance. There are two types of government insurer: Medicare and Medicare. Medicare and Medicaid. Okay, first we'll see Medicare. Medicare is a federal health insurer program administered by Centers for Medicare and Medicaid Services, also known as CMS. Centers for Medicare and Medicaid Services, that provides coverage for people over the age of 65 years, or blind or disabled individuals, and people with permanent kidney failure or end-stage renal disease. End-stage renal disease, also known as ESRD. Okay, so please make sure that if you want to make your career in medical coding, please be aware of this Medicare and Medicaid, difference between Medicare and Medicaid. Okay, because surely your interviewer going to ask you this question: what is difference between Medicare and Medicaid? Okay, so Medicare is a federal health insurer program which provide coverage for people over age of 65 years, okay, or blind or disabled people, or people with permanent kidney failure or ESR. Okay, there are the Medicare program is made up of 4 parts. There are 4 parts of Medicare. Okay, first one is Medicare Part A. Medicare Part A covers inpatient hospital care as well as care provided in skilled nursing facilities, hospice care, and home health care. Okay, healthcare Part A covers inpatient hospital care. Okay, then next one is Medicare Part B. Medicare Part B covers medically necessary physician services, outpatient care, and other medical services, outpatient care, and other medical services not covered under Medicare Part A. So you can see here Medicare have made up of 4 parts. Okay, Part A which cover inpatient hospital care, Part B which covers outpatient care. Okay, so here outpatient care is also included in Medicare. Then third one is Medicare Part C. also called Medicare Advantage, because it combines benefits of Part A and Part B, and sometimes Part D also. Okay, so Part C, Medicare Part C is combination of other three parts. Okay, Part A, Part B, and sometimes Part D also. So if patient wants to get benefits of both the parts, means inpatient care also and outpatient care also, they have to choose Medicare Part C. So then fourth one is Medicare Part D, which is related to prescription drug program available to all Medicare beneficiaries. Okay, these are related to drugs. Okay, so again, Medicare Part A covers inpatient hospital care, Medicare Part B covers outpatient care, Medicare Part C covers benefits of other three. Okay, and Medicare Part D covers drug prescription. Okay, this is the differentiation between four of them. Part A, hospital coverage, inpatient care in hospital including critical access and long-term care hospitals. Then Part B covers doctor's services and outpatient care when medically necessary. Then Part C covers, it is also known as Medicare Advantage Plan, includes all of Part A plus Part B as well as extra benefits like Part D also sometimes. And next Part D is prescription drug coverage, available in standalone plans or as part of Medicare Advantage. Okay, so please note of this. Part A covers inpatient care, Part B covers outpatient care, Part C cover benefits of Part A plus B and sometimes Part D also, and Part D covers prescription. Understand? Any doubt? No. Okay, so now we'll see another type of insurer, government insurance, which is Medicaid. Okay, Medicaid. This is health. This is a health insurance assistance program for some low-income people, supported by federal and state governments. Okay, this Medicaid program is for low-income people. Medicare is for above 65-year-old or physically blind or disabled people, right? But Medicaid is for low-income people, and this is sponsored by federal and state governments. It is administered on a state-by-state basis, but state programs must adhere to certain federal guidelines. Okay, state by state, their rules get changed. Okay, state-funded insurance programs providing coverage for children up to 21 years of age may include children's medical services, children's indigent disability services, and children with special healthcare need and others. Okay, now we'll see difference between Medicare and Medicaid. Please make a note of it because this is most important part in medical coding. You surely get a question on this point. So, Medicare and Medicaid. Governance, Federal Health Insurance Program. Medicare is Federal Health Insurance Program strictly governed by federal government, whereas Medicaid is joint federal and state program but governed by state governments. Okay, eligibility criteria for Medicare 65-year or older, or the older than 65 years. Okay, under 65 with certain disabilities, blindness or any other disabilities. Okay, if below 65 years old, then any age, and who have end stage renal disease or any other diseases, life threatening diseases. Okay, then Medicaid eligibility criteria is individual and families with limited income and resources are covered under Medicaid. Then coverage includes for Medicare inpatient care, skilled nursing facility, these are covered under Part A. Then outpatient and some preventive care covered under Part B, and prescription drugs covered under Part D. Okay, and Part C include all of these three. Okay, whereas coverage include for Medicaid is inpatient care, skilled nursing facility, outpatient care in federally qualified health centers, and rural health clinics. Okay, then costs. For Medicare, costs depend on the coverage. Means which part you are choosing for your coverage. It depends on how much it will cost for you. Then Medicaid cost depends on the individual's income and the rules, policies, and procedures in the given state. Each state has their own Medicaid rules. Okay, so this is difference between Medicare and Medicaid. The major difference is, at least you have to remind that Medicare is for 65 year or older than that people, or if under 65 year age, then with certain disabilities or life threatening diseases like ESRD. Okay, and Medicaid is for low income family. That's the difference between Medicare and Medicaid. Now we'll see what is RBRVS. Okay, this is Medicare payment for physician services are standardized using a resource-based relative value scale. Resource-based relative value scale, which is nothing but RBRVS. This scale is used for determining the payment for Medicare physicians. Okay, the resource costs are divided into three components: physician work, practice expenses, and professional liability insurance. Okay, you might have thinking what is the importance of learning all these terms, but if you are going for in daily medical coding, you may not need to use this all of this. But if you want to go for medical coding interview, or most important, if you want to go for medical coding certification exams, then you're going to get at least 5 marks question on this topic or on this chapter, which is business of medicine. Okay, and these questions are straightforward question. You will get answered directly on in your book if you know it properly. Okay, so that's the reason why this is the important chapter. Okay, so RBRVS are depend on physician's work, practice expense, and resource-based professional liability insurance, also known as PLI. Physician work is measured by the time it takes to perform the service, the technical skill, and physical efforts, the required mental effort and judgment, and stress due to potential risk to the patient. Okay, means complicated surgery. If surgery is complicated, value is more, right? Physician have need more technical skill. Physician has to do more physical efforts, mental efforts, judgment. Stress is also more. If it is threatened to that surgery will going to threaten to patient's life, right? Then second is practice expenses. Practice expense relative value are resource based and differ by site of service. For example, the expense of providing a service in hospital may be different than the expense of providing same service in a physician's office. Okay, if service is provided in a physician's office, the expense may differ than service provided in hospital. Correct. Then third one is the resource based professional liability insurance, PLI. This component accounts for 4% of total relative value of each service. Okay, you no need to by heart this all this term. You just have to remember the full form of RBRVS. Okay, other things you are going to get in the book. Then we'll see what is medical necessity. The medical necessity refers to whether a procedure or service is considered appropriate in a given circumstances. Okay, Medical necessity refers to whether a procedure or service is considered appropriate in a given circumstances or not. Okay. Generally, a medically necessary service or procedure is the least radical service or procedure that allows for effective treatment of the patient's complaint or condition. Okay, medical necessary services or procedure are important services which allows for effective treatment for patient's complaint. When a physician provides services to a Medicare beneficiary, he or she should bill only those services that meet the Medicare standard of reasonable and necessary for the diagnosis and treatment of a patient. Okay, there are two types of coverage determinations within Medicare, national and local. Okay, two types of medical coverage determinations which are national and local. First one is national coverage determinations. NCD, also known as NCD, National Coverage Determinations. These are applicable nationwide in the US to specify the Medicare coverage of certain services. All Medicare contractors have to follow the NCDs. Okay, means if a physician performs some procedure, okay, the diagnosis should be covered under that procedure. Okay, that is called medical necessity. That can be national or local. Okay. Second one is local coverage determinations, also known as LCD, local coverage determination. These are made based on medical necessity and are released by Medicare contractors. LCDs are applicable only to the contractor's region, as these are local coverage determinations. Okay, these are applicable only to the contractor's region. Okay, in cases where an item or service is not covered by NCD, the local contractor has to take responsibility for the decision for its coverage. Okay, if any service or procedure or any item provided to the patient is not covered by NCD, National Coverage Determination, then local contractor, it's the responsibility of local contractor for the decision of its coverage. Non-Medicare or you can say commercial payers may develop their own medical policies. Okay, the Advance Beneficiary Notice, also known as ABN, Advance Beneficiary Notice. An ABN is a written notice from Medicare given to you before receiving certain items or services, notifying you that Medicare may deny payment for that specific procedure or treatment. Okay, this is a written notice from Medicare given you before receiving any item or service, anything. Okay, to notify you that Medicare may deny payment for that specific procedure. Okay, the ABN lists the item or services that your doctor or healthcare provider expects Medicare will not pay for. Okay, along with an estimation of the cost for that item or services and the reason why Medicare may not pay. Okay, ABN lists the items or services that your doctor or healthcare provider expects Medicare will not pay for, along with estimate of cost. Okay, cost for items and services and reason why Medicare may deny your payment. Okay, this is called ABN, which is nothing but written notice from Medicare given you before receiving any item or services to notify you that Medicare may deny payment for that particular service or treatment. The need for privacy and security. HIPAA. Remember, HIPAA means nothing but Health Insurance Portability and Accountability Act. Health Insurance Portability and Accountability Act. HIPAA. HIPAA protocols regulate the information and transmission of patient health records data. This system requires healthcare providers to implement data security measures So they fulfill the regulations from the government, prevent any kind of theft of any information stored on healthcare record, and guarantee patients' privacy. Okay. HIPAA coding is one such regulation of the HIPAA system that is designed to instruct medical coders on how to follow fair and honest data usage when of coding, and how to keep patients' health record safe and secure. Basically, this HIPAA coding is regarding keep the patient's healthcare information private. Okay, how you can keep patient's healthcare records safe and secure. Okay, HIPAA teach you or HIPAA educate you on that to keep the patient's health records safe and secure. You can't leak any patient's information any with any other company or any other person. Okay. Covered entities of HIPAA. Covered entities under HIPAA are individuals or institutions or organizations that transmit protected health information electronically in transactions for which the Department of Health and Human Services HHS has published standards. Okay. Covered entities of HIPAA means who are eligible to use the eligible or who are allowed to transmit the patient's health information. The covered entities are providers, which include hospitals, clinic, nursing homes, doctors, or pharmacies. Okay, they can use patients' health information data and transmit them. Okay, in protected manner. Then health plans, HMOs, private company, government and veterinary insurance, etc. Then clearing houses, which processes and transform data for a healthcare organization. Okay. Then associates, which perform functions for HIPAA entity that involves the use or disclosure of PHI, patient's health information. PHI means patient health information. Okay. Then subcontractors, which maintains or transmits PHI means patient's health information on the behalf of a business associate. Okay. Like we as a medical coder, we also need to use patient's private health information, right? So we are also covered under HIPAA. Then just a minute. HITECH and its impact on HIPAA. Now we'll see what is HITECH. Okay, the health information technology for economic and clinical health, or also known as HITECH. HITECH means Health Information Technology for Economic and Clinical Health Act, was enacted as a part of American Recovery and Reinvestment Act of 2009, which is also known as ARRA, American Recovery and Reinvestment Act of 2009. The HITECH Act was introduced in 2009 in United States to strengthen HIPAA privacy and access goals. Okay, to strengthen HIPAA privacy and access goal, HITECH comes in picture. HITECH Act was introduced in 2009. Okay, HIPAA introduced more than a decade ago in 1996. Okay, in 1996, HIPAA was introduced, where and that HIPAA regulations wasn't written with the explosion of internet and web applications in mind. Okay, at that time in 1996, internet explosion, different web applications are not in use, right? So that HIPAA written without keeping in mind that explosion of internet and web applications. Okay, so the HITECH Act plugs the technology gap and take responsibility of securing patient's health information on healthcare organizations and related with access to patient health information. Okay, to fill the gap, technology gap, the HITECH Act is introduced. Okay, HITECH also mandate that organizations notify health plan members or or patients if their files get breached. If their file get breached, the HITECH also mandate that organization must notify health plan members or patient. Okay. Now we'll see fraud. What is fraud? Fraud is when someone knowingly gives false information that allows someone to get a benefit that is not allowed. Okay. Fraud means when someone knowingly gives false information that allows someone to get a benefit that is not allowed. Okay. Examples of fraud like double billing means submitting multiple claims for the same service is an example of fraud. Again, phantom billing also meaning billing for a service visit or supplies the patient never received. Okay, which is also example of fraud. Then unbundling, submitting multiple bills for the same service. Remember, I told you about modifiers, right? At that time, I told you that as a medical coder or in the medical bill, we can't assign same CPT code more than once. Okay, and if we need to, we have no choice. We have to use only one CPT code twice or thrice, okay, or more than one time. Then we have to append proper modifier. Otherwise, the claim will denied or get rejected. Okay, but some person who were intention is to make a fraud, they submit multiple bills for the same service. Okay, and that is example of fraud. Then upcoding, billing for a more expensive service than the patient actually received. Okay, then bogus marketing, convincing people to provide their insurance information number, health insurance identification number and other personal information to bill for non-rendered services, steal their identity and or enrollment them in fake benefit plans. Okay, bogus marketing means convincing people to provide their health insurance identification number and other personal information to bill for non-render services or steal their identity, okay, or enroll them in a fake benefit plan. Then next example is identity thief or identity swiping, means using another person's health insurance or allowing another person to use your insurance. Okay, that is also example of fraud. So the fraud is when someone knowingly gives false information that allows someone to get a benefit that is not a fraud. I will see abuse. Abuse is when someone knowingly take actions that result in unnecessary cost or service. Abuse is when someone knowingly take actions that result in unnecessary cost or services. Example of abuse is are incorrect use of medical codes. Okay, use of wrong medical code is example of abuse. If you assign more complicated code, obviously patient it will cost patient higher value. Okay, but that is not correct. That is called abuse. Okay, charging excessively for services or supplies. Okay, then billing the brand name instead of generic name of a drug to gain an unfair edge because generics are 80% to 85% less expensive than the brand name. Okay. Then upcoding is when a provider assign inaccurate billing code to a medical procedure or treatment to increase reimbursement. Okay. Sometimes what happens, the provider also directly give you code. Okay, rather than giving whole description of the CPT, they also code the report. And as a medical coder, your job is to audit that report, audit those codes. Okay, and in that cases, some provider also assign inaccurate billing code to the medical procedure or treatment to increase reimbursement. That is example of abuse. Then last is unbundling in the coding services. Unbundling takes place when a provider files separate CPT codes for each treatment, despite the fact that a relevant integrated CPT code covering the entire procedure is usable. Means instead of using the combined CPT, okay, in procedure coding, in CPT coding, few procedure have combined code also. Means if there is bilateral knee CPT, knee X-ray was done, okay, but doctor is what can I say? Doctor or provider files separate CPT for them. Okay, separate CPT for knee, right knee, and separate CPT for left knee. That will cost more. Okay, rather than combined CPT. This is also example of abuse. So abuse is when someone knowingly take actions that result in unnecessary cost or services. Okay, if you are going for medical coding certification exam, you are going to means that exam include at least 5 mark question on this topic. Okay, this is business of medicine, and these questions are straightforward question. Okay, you will get their answer directly in your book, as these exams are open book exams. You will get their answer in book itself. Just you need to go through your ICD, CPT, all the books. Okay, so that at the time of exam, you must have to know where you can find your answer. Okay, so don't worry if you didn't understand some part of it. It's okay. Okay, just try to recollect the major, what can I say, full form of those short forms. Okay, like other the difference between Medicare, Medicaid, and like this. Okay, now we'll see some acronyms. Here you can find all the full forms of the shortcuts. Okay, or you can say acronyms. ABN means Advance Beneficiary Notice of Non-Coverage. You can get question like this also. ABN means what? What is the full form of ABN? And you get 4 options. You have to choose one option. Okay. So ABN is Advance Beneficiary Notice of Non-Coverage. Then AMA is American Medical Association. APC means Ambulatory Payment Classifications. ARRA means American Recovery and Reinvestment Act of 2009. American Recovery and Reinvestment Act of 2009. You may get question like this: in which year ARRA Act is published? Okay. Then ASC. ASC is Ambulatory Surgical Centers. Then CF, Conversion Factor, known as CF. CMS is Centers for Medicare and Medicaid Services. This is commonly used acronym. CMS, Centers for Medicare and Medicaid Services. Then CPC is Certified Professional Coder. CPT is Current Professional Terminology. Okay. Then DRG is nothing but Diagnosis Related Group. This is related to inpatient coding. Okay. Then EHR means Electronic Health Record. This is nothing but EHR. EM or ENM means Evaluation and Management. This is also one type of specialty, medical coding specialty. CA. GPCA means, GPCI. GPCI means Geographic Practice Cost. HCPCS. HCPCS also known as HIPAA means Healthcare Common Procedure Coding System. Then HHS. HHS means Department of Health and Human Services. Then HIPAA. HIPAA means Health Insurance Portability and Accountability Act of 1996. Please remember this year also, 1996. Then HITECH. HITECH means Health Information Technology for Economic and Clinical Health. Okay. Then HMO means Health Maintenance Organization. Health Maintenance Organization. Then ICD-10-CM means International Classification of Diseases, 10th Clinical Modification. International Classification of Diseases, 10th Clinical Modification. ICD-10-PCS means International Classification of Diseases, 10th Revision, Procedure Coding System. Okay. PCS means Procedure Coding System. These code sets are used only for inpatient procedure coding. Okay. Then LCD, Local Coverage Determinations. Then MAC means Medicare Administrative Contract. Then MP means malpractice. MSDRG means Medicare Severity Diagnosis Related Group. Again, MSDRG also related to inpatient coding. NCD means National Coverage Determinations. Okay. NP means Nurse Practitioner. OIG means Office of Inspector General. Office of Inspector General. And OCR means Office for Civil Rights. Office for Civil Rights. Then PA means Physician Assistant. PE means Physician Expense. Then PFS means Physician Fee Schedule. PHI means Protected Health Information. Protected Health Information. PLI means Professional Liability Insurance. RVU means Relative Value Unit. And RVS means Resource Based Relative Value Scale. So these are few acronyms you have to keep it in mind. Okay. And on this chapter, you surely get 5 questions in your CPC examination. Okay. So this chapter is very, very important. Okay. Then lastly, if you have any question, you can ask me. Anyone? No question? Then thank you for your attention. Thank you for your attention and thank you for making this session interactive. If you want to register yourself for medical coding course with our organization, please go on to the given link below www.greatonlinetraining.com and register yourself. Bye bye. Take care.